Welcome back. We're talking about pregnancy, and I want to go straight to mood swings. Is it true? Do women really have mood swings when they get pregnant, especially the first few months?
Yeah, yes, they do. More often for those that are just entering for the first time, they have mood swings.
Why?
Why do they have mood swings? Especially, first of all, when pregnancy starts, there are a lot of hormonal, changes in the body. The woman starts noticing some strange things in her body. Like I said, before pregnancy, I need to get pregnant. That's always the expectation. But when it comes, because many of them have not experienced it before, when it comes, they begin to experience some changes in their body. There's a hormonal surge, and they feel somehow. They begin to wonder, what's this? Then, of course, and it's mood swings. It changes. After a while, they just overcome it. Oh, they feel good. After another time, they are like, am I okay? They wake up. At the time, they start having some strange cravings, some weird things they want to eat.
Some women cry sometimes for no reason.
Yes, it's part of the mood swing.
Yeah, I think husbands need to hear this one.
Exactly. So, of course, for the experienced one, especially for the men, they just know that this is one of those things. They know how to actually take care of the woman. But for the first timers, those are just starting. It's strange. What's this? But it just after a while, it just overcome it, and it's all exciting again.
Okay, let's take this call. Hello.
Hello, good afternoon,
Good afternoon, Olaide. What will your question be?
Okay, ma, I'd like to know when exactly is the fertility date? Like I saw something on your screen just now.
That was the menstrual cycle.
Phase.
Okay.
And the menstrual cycle, I don't really understand because sometimes mine is for 25, sometimes mine is for 28. And I actually don't know when is the fertility date.
Okay. I think the doctor can explain that. When is a woman most fertile?
Okay. Thank you for the question. It's easier to predict when a woman's menstrual cycle is regular, especially the 28-day cycle. Okay? Because there are 3 common cycles that are considered normal: 21, 28, and 35. But if a woman's menstrual cycle length is juggling between 25 and 28, she is very difficult to see the exact time she would, achieve pregnancy or avoid pregnancy. But if it's trying to achieve pregnancy, usually for the 28-day cycle, the day of ovulation will be about day 14, the mid of it. Okay? Day 14, that's when we expect her to, ovulate. If her menstrual cycle is 25, she should remove 14 days from 25. Okay, if for instance our menstrual cycle is regular at 25, she should remove 14 days from 25. So that will give you about day 11. So she's more likely to ovulate around day 11 because the second half is almost constant. So if she wants to try and achieve pregnancy, she can start having intercourse about day 9 of her menstrual cycle, and the intercourse is going to span about 5 to 6 days. So it's not just one day, because the sperm will spend some days in the woman's body, so also the egg spends some days, at least 48 hours. So for such a person who has 25-day cycle, she can start having intercourse from day 9, 11, 13, 15, just like that. So that period is a fertile period. But if a woman wants to avoid pregnancy, it's not okay to use that because it changes and it can be very deceptive. So, but to achieve pregnancy, yes, that's a period the woman should expect to get pregnant if she has regular intercourse.
Wow, thanks for that.
Yes.
Let's talk more about medicines. You said that, first of all, a woman shouldn't even take medicines without telling her doctor. Yes. But some people have prescription drugs, things they take normally. For example, those who have asthma. Would that be a problem?
You see, yes, asthma has some drugs that, when a woman is pregnant, she will avoid. There are some that are friendly. But what happens is, any of those conditions, we co-manage with the specialist. A woman has asthma, a woman has seizure problem, a woman has thyroid problem, other medical conditions, a woman has diabetes.
Sickle cell disease.
Any of them. We manage with specialists in the sense that, so that the drug, we discuss the drug between the specialist and the obstetrician. Obstetrician does not just single-handedly manage such patient, because there are some drugs that need to be stopped.
So sometimes you change the medication.
Yeah, you change some drugs.
Let's quickly take this call from Richard. Hello, Richard.
Yes, madam. Good afternoon.
Good afternoon, Richard.
Yes, God bless you, ma. I want to find out, is it normal for a woman that is with 7 months pregnancy to be having pains at the tummy all the time?
Okay.
And she has made this not her first time, she has 2 kids already. Well, this time, she always complains of pains in the tummy. She will go to the hospital and they will say it's normal, but I consider it not to be normal. I don't really know. That's why I'm asking for the doctor.
Okay, thank you so much, Richard. Pains in the stomach at
Okay.
7 months?
7 months. Generally, a woman should not have any pain during pregnancy, okay? However, there are the womb, the uterus, is not always in the quiet state. There's some little movement, okay? We call it contraction that could occur. Sometimes they have some discomfort from it. But when a woman has a persistent pain in pregnancy, it's usually will not be normal. They will need to present, and some necessary investigation will be carried out on the woman. The scan will be done. Sometimes it may just be urinary tract infection that some of them will have. But because the way it presents, it's, somebody who is not experienced will just say, don't bother, it's normal. But some further investigation needs to be carried out, more questioning. And after, much detail, you may find that it may not exactly be normal, because a woman should, except the woman is having contraction, she should not have pain that would disturb her. She should not have pain that will make her not sleep. But if a woman is having what we call preterm labor, when it's not time, she starts having contractions, you will have pain. But with good history, when we ask good questions, we're able to elicit the real cause or the likely cause of a pain. So it would be good for me to say that pain is normal, because we need to ask the woman more questions and do maybe a scan.
Okay, so thank you very much. We have to go now. Thanks for coming. That was beautiful. Thank you for staying with us. Thanks for your calls, Elizabeth, Olaide, and Richard. Let's do it again another time, and have a lovely day. I am Mary Alale Yusuf.